A woman came to the hospital, pregnant woman, and she just said, "Doctor, I think I'm around 7 months pregnant." I was looking at her. We actually don't count pregnancy in months. We count it in weeks. And the only way we could get the actual weeks and days is by knowing the woman's first day of her last menstrual period for that pregnancy. So I asked her, what was her last menstrual period? She said, "Doctor, scan said." I said, "Madam, no. It's not who menstruated. Is it you or the scan?" And she started laughing. But actually, this brings us to today's topic, first trimester of pregnancy, and even the importance of knowing your first day of the last menstrual period. Now, I'm Dr. Chukwemeka Precious Anyogu. Before I even go further, I'm Dr. Chooks. I'm here for you. I want to talk about the importance of knowing the first day of your last menstrual period. It is the best indicator, the best thing to use to calculate the age of your pregnancy at any stage of the pregnancy, and also to calculate your EDD. It is the most accurate, more accurate than any scan. These days, most women just rely on, I've done scans, scans say this, scans say that. Yes, scan is good. Scan is a second choice. As regards dating the pregnancy, as regards calculating your ED, is the second choice. The first choice, the plan A, is actually the first day of your last menstrual period. So don't play with that date. Don't forget it. Okay? Always keep it in mind when you're pregnant. Now, the importance of knowing the changes your body will begin to go through in the first trimester of pregnancy is also important. Like I shared that with you. Your progesterones are beginning to rise. The placenta is trying to be formed, and this is the formative phase or the formative trimester of the baby. It is when the child is beginning to form. The cells, the tissues, the organs, the systems of the baby from all are formed. So it is a very vital trimester, the first trimester. That is a time when a lot of medications are not encouraged, are not allowed for a pregnant woman. That's why when you notice you're pregnant, before you take any medication, you must ask your doctor, is it safe for me and my baby or not? Don't just walk into any medicine store and just pick up any medicine and start taking when you're pregnant, especially in first trimester. In first trimester also, that's when the woman begins to have issues with appetite, breastfulness, begin to have some weird food cravings. But don't worry, doesn't mean there's a problem. It's still your body trying to adapt to the new pregnancy changes. And some women, in fact, those who have had peptic ulcer disease before, they begin to have worsening of the symptoms because they don't eat much as before. And of course, hunger worsens the ulcer pain. So try your best to eat. And I know it's not going to be easy, especially in first trimester, and I mean first 13 weeks of first treatment, but you try your best. Then ensure you continue taking your folic acid, like I mentioned in the previous videos, and also ferrous sulfate. That's what people call blood tonic or blood capsules. Ensure you continue taking them. Or if you want to take them as the combination medications, those ones that come as all this prep mom, prep care, pregnancy care. Many companies with different combinations, they are also good, but ensure they are for pregnancy. But remember, any other drug that is not meant for pregnancy that you want to take during pregnancy, you must go and see a doctor. It must be prescribed by a medical doctor. I'm saying medical doctor for a reason, please. So you take what is safe, especially in first trimester of pregnancy, so that your baby will be fine and you also will be fine. I will talk about challenges of first trimester in pregnancy, especially early pregnancy loss in the next pregnancy. And with time, we'll also talk about hemolytic disease of the newborn and other effects that could happen. Those will be later in pregnancies. But now, I'll end this video here.